Hello, everybody. Welcome to our August webinar, a collaborative presentation of the Federation for Children with Special Needs and the Recruitment Training and Support Center. My name is Janie Kreco, and I am the Training and Support Specialist at the RTSC. Today's webinar is You Can't Make Me Go, Practical Tips for Dealing with School Refusal, presented by Dr. Lauren Marchette. Lauren is the co-director of the Child and Adolescent Cognitive Behavioral Therapy Clinic in the Department of Psychiatry at the Cambridge Health Alliance. She also has a private practice in Weston, Mass. and is on the faculty at Harvard Medical School. Her training is in child clinical psychology as well as school psychology, and she is an expert in an array of evidence-based youth psychotherapies, including an innovative transdiagnostic approach. In addition to providing direct clinical care to children, adolescents, and their families, Dr. Marchette offers trainings, seminars, and supervision in the United States and around the world on the implementation of best practices in youth mental health care. She is actively engaged in research, and her writing appears in many scholarly journals and books. So during the webinar, please type your questions in the toolbox, and we will answer them at the end of the presentation unless there's a point of clarification. Past webinars are archived on the RTSC webinar website, along with many resources on trauma and learning and educational issues that impact students in child welfare. Lauren, welcome. I am so glad that you're here. Everybody's very excited to hear what you're going to be telling us today. So,
great. Thank you so much for inviting me to be here. And it's great to have the opportunity to talk with you today about school refusal. If you're joining this webinar, I imagine you've had some experience with school refusal, maybe professionally or personally, or you may just be interested in understanding what to do if this issue arises in the future. As many of you know, school refusal is very challenging. If left unaddressed, it can have detrimental effects on all of those involved, especially children. My goal today is to be able to equip you with tools for what to do if you are faced with school refusal. So I'll start just with an overview of what I'll be talking about. First, I'll provide general information about school refusal that will lay the foundation for what we'll be talking about going forward. Then I'll offer some practical tips, both general tips and then specific tips for people that are within educational settings, and also tips for caregivers. And what I mean by this is, broadly anyone who is having caretaking responsibilities for children in the home. And I'm using the term children to really encompass anyone from 5 years old up through high school. And after we talk about some general tips, then I'll give recommendations for how to address more serious cases of school refusal. And to provide more information about what that actually looks like, I'll tell you about an example of a student I've worked with school refusal. And finally, I'll just summarize some of our key points, and then there'll be time for questions at the end of this webinar. So to begin, I want to mention that there are lots of different concepts that people use to describe the same term. So you might have heard school phobia, school avoidance, school anxiety, or absenteeism. They're all synonyms, and I'm going to be using the term school refusal as it is just a broad, inclusive concept that is meant to include all of these other terms. So by school refusal, what I mean is refusal to go to school on a regular basis or problems staying in school. Now, school refusal should be thought of as heterogeneous. You can imagine many different ways in which you might see school refusal. There could be a 6-year-old child who's clinging to his mother right before school is starting in the morning, crying, saying he doesn't want to go into school. Or maybe there's a 4th grade girl who's in the classroom and constantly asking to go to the nurse's office. Or maybe a teenager who should be staying in school but tends to kind of skip school, and especially periods during the day that he or she doesn't want to be in. So very heterogeneous issue, and there can be many different reasons or causes that a student might refuse to attend school or remain in school. Now, these can be fears originating within the school environment, such as social and peer-related difficulties, so peer teasing or conflict. This could also be learning and curriculum challenges or difficulties with the physical environment. Some kids feel really uncomfortable in busy hallways or in crowded cafeterias. There can also be family and community-based concerns that make it hard for students to go to school. Maybe kids don't want to be away from a parent or a loved one because they're afraid something bad might happen to them during the school day. Or there are students who may choose to stay away from school as the alternatives, such as playing video games in pajamas all day, sound much more enticing. Whatever the reason, school refusal is a significant problem affecting students, families, communities, and schools. And up to 28% of school-age children refuse school at some point. For many, this goes away on its own, but for some kids, school refusal behavior persists. School refusal can be viewed on a spectrum of absenteeism, from substantial distress while attending school with pleas to not attend, to misbehaviors in the morning to attempt to stay home from school, or chronic tardiness to school, or skipping certain classes or periods of school during the day, all the way up to lengthy absences from school. Now, I want to point out that most, if not all, children refuse to go to school once in a while. But school refusal is an extreme pattern of avoiding school that causes actual problems for the child. It's distinct from normal school avoidance based on the following. So the length of time that a child has been avoiding school, also the amount of distress that's associated with attending school, how strong the resistance to attending school is, and how much is their interference from this resistance to go to school. Now, while this school refusal is not considered a psychiatric diagnosis, it's often comorbid with a variety of psychiatric conditions. Some of the most common include separation anxiety, social anxiety disorder, specific phobia, panic disorder, persistent depressive disorder, or adjustment disorder. And I want to again point out with this distinction between normal avoidance and school refusal, it's really important to keep in mind all of those different areas that I mentioned, those 4 different areas, because sometimes kids have school refusal even if they're attending most days. I've worked with kids who have missed only a day or 2 of school, but who have been tardy 20 times because their anxiety is so intense it keeps them from arriving at school on time. So keep in mind that kids with school refusal might also have a habit of leaving early, spending a lot of time visiting the school nurse, or texting parents throughout the day. Now we're going to talk about some common school refusal symptoms. I've included both internalizing or covert symptoms that you might see, as well as externalizing or overt symptoms. Now, you might not see all of these, but I want to be able to just describe the ones that are most typical. So for internalizing, you may see symptoms of depression. You might also see tiredness or fatigue, fear and panic, generalized and social anxiety, self-consciousness, excessive worrying, and also somatic complaints. Now, these somatic symptoms could be autonomic, including dizziness, headaches, shakiness and trembling, heart palpitations, chest pains, or they could be gastrointestinal, encompassing abdominal pain, nausea, vomiting, and diarrhea, or they could even be muscular, so back and joint pain. In terms of externalizing symptoms, you may see aggressive behavior, excessive reassurance seeking from caregivers or other adults, refusal to get ready for school in the morning, and more general non-compliance and defiance, so refusing to comply with adults' requests. You may also see clinginess toward an adult and temper tantrums or crying, or even running away from home or from school. So who experiences school refusal? What's been found is that there are equal rates among boys and girls, and school refusal occurs across the range of socioeconomic status. At this point, there's little information about ethnic differences, But I will point out that dropout rates for Hispanics are significantly higher than for other ethnic groups. In many countries around the world, the preschool and early childhood years represent an important developmental period when young children develop the capacity to separate from caregivers, and they learn to function more independently at school. This time, between 2 and 7 years of age, is a transition time when children adjust to this developmental expectation, and it is expected that some children will experience distress about being away from caregivers. Most children are able to gradually adjust, whereas some kids still have trouble with this. Other kids may cope relatively well in preschool and kindergarten, but may become distressed when academic and social demands at school increase. The most common age of onset for school refusal is between 10 and 13 years of age, but it also peaks between 5 and 6 years of age and 14 and 15. And the reason for these times is because these are when there are significant school transitions, such as entering entering kindergarten, entering middle school, and entering high school. Refusal would be after vacations, weekends, a period of absence from school, for instance, for an illness. A stressful event can then lead to school refusal, or when moving or changing schools, and at the beginning or ending of a school year. So why should we care about school refusal? I'm guessing because you're joining the webinar, you already do care, but just to go over some of the short-term and long-term effects of this issue, in the short term, there's of course significant distress for kids. Kids can also fall behind academically and have trouble meeting academic milestones. They might also have some peer alienation as they have trouble developing and maintaining friendships. Also, there could be family conflict and even financial and legal repercussions for kids not going to school. In the long term, kids are more often going to have school dropout, delinquent behaviors, even economic deprivation from a lessened chance of attending college. And there can be occupational and marital problems, as well as poor psychosocial functioning, often in the forms of depression or anxiety. So I want to tell you about some of the factors that are known to be present and possible causes of school refusal. So these will include social isolation, so kids who are kind of withdrawn from their peers. Also, bullying can be a precipitant, and poor relationships with teachers, difficulty juggling academic demands, and kids who have poor coping skills, or even just the perception that they have trouble coping. Once school refusal starts, there are certain factors that are more likely to maintain this problem. One is poor coping skills. Another is secondary gain to staying at home. Now, the average home today has computers, iPads, smartphones, gaming systems, and TVs hooked up to cable, Netflix, and other on-demand and streaming services. So who wouldn't want to stay home and play with their gadgets rather than go to school and face a challenging curriculum and potentially tricky to navigate social situations? Another potential maintaining factor would be caregivers' own anxiety and uncertainty about how to best manage the situation when school refusal comes up. Students often also will have fears about others asking why they've been missing school. And another issue can be limited support at home. So this would be caregivers that just aren't quite sure how to help kids return to school, or have other kind of issues that are getting in the way of supporting their kids as going back to school. Also, accepting the situation, so children and caregivers thinking there's nothing they can do to make this better, can be problematic. School-based difficulties, so this would be staff unable to support students, or schools that don't have enough resources to be able to address the kinds of needs that kids have. And there can be poor cooperation among adults who are supposed to be supporting the student and returning to school. And I've definitely noticed that in the case of school refusal, there can be friction that develops between children, caregivers, and schools. And so this eroded relationship over time can certainly lead to the maintenance of school refusal. There are also some family factors that are correlated with school refusal, and these have to do, first of all, with cohesion. So over-dependency, where there are overly close family relationships, or kind of the opposite, detached family relationships, where there's little interaction among family members. There are also isolated family units, so families that don't have much interaction with anyone outside of the family, and then situations where there's heightened conflict and also communication difficulties. However, besides these different kind of precipitating factors and these maintaining factors, there also are protective factors that are important to keep in mind. So one is a secure caregiver-child attachment, that healthy attachment. In addition, caregivers who share parenting responsibilities and who are consistent, clear, and firm with their expectations can be really helpful to kids. Understanding anxiety and factors that maintain it can help with reducing school refusal. Having high levels of support from the home, from the school, from the community, and low levels of stress can be really beneficial. Having students with an easy temperament, average ability, healthy coping skills, and good interpersonal skills can be really helpful as well. Also, when schools have resources and knowledge necessary to support the student, this is an important protective factor. And having good, close collaboration between those who are involved in supporting the student can be really helpful as well. So some of these may be harder to change, but at the same time there are ones that are malleable and are really worth paying attention to see how we can be further building these protective factors. So now I'll start talking about some general tips. So first of all, it's really helpful to recognize the common warning signs of school refusal. These include frequent unexcused absences or tardiness. Also absences on important days. So if there's standardized testing happening or big presentations that might be going on. Recurrent requests to go to the nurse's office, particularly in the absence of any known illness. And then frequent requests to call home or even text home throughout the school day. And trouble or resistance about getting out of bed in the morning to go to school. So it's really important to catch school refusal as early as possible and intervene quickly using a team approach. Now this team could include parents, teachers, administrators, support staff, and sometimes community agencies and physicians. And it's important that they're all working together to create an appropriate action plan. The longer a child misses school, the harder it is to get back into the routine of going to school because missing school can be reinforcing. So we really want to avoid prolonging time at home. In addition, I want to say that it's really important that kids stay in school throughout the day unless there are intense medical symptoms present. And here you can see a few of them, which include frequent vomiting, bleeding, a temperature over 100 degrees, severe diarrhea, lice, flu-like symptoms, or extreme medical conditions like pain. Besides those, kids should generally be able to stay in school throughout the day. So now I'm going to talk about some specific tips for people within educational settings. So it's really helpful if teachers or school counselors, school psychologists, anyone at school can help caregivers to bring children into the school when they're reluctant, they're acting out, maybe they're anxious about separating from a caregiver. Also, it's great when kids have something to look forward to in the beginning of the school day, so assigning special tasks to kids can really benefit them in making them more excited to come to school. And it's important to be working closely with caregivers to monitor attendance. I've also found that assigning a peer buddy can be very helpful for kids who might feel more uncomfortable during unstructured times like lunch and recess. And ensuring that there are academic interventions and supports in place for any students with academic challenges can be really helpful so that kids are not trying to avoid particular subjects or areas of academic difficulty for them. And sometimes it's also helpful to set up incentives for attending school, and this would just be to enhance kids' motivation. And these could be free, just something that kids can look forward to in the school day, whether it's playing a certain game with a teacher they really care about, or any other kind of options that are feasible within the school. It's great when a particular school staff member, such as a school counselor, a nurse, a school psychologist, can be identified so that the child knows exactly who to go to if he or she is feeling anxious or overwhelmed. Also, it's important to ensure that there aren't bullying or other kinds of violent situations happening at school that are leading to kids not wanting to go to school, in which case, if those are there, it's helpful for schools to have anti-bullying and anti-violence interventions. Now, it can be helpful just in general to have those also as a preventative measure. And we want to make sure that kids feel really welcome at school and they're excited to go to school because they feel very connected to the school setting. And just as we want kids to feel connected, we also want families to feel connected, which can be accomplished through outreach and other school programming. Now, sometimes for kids, it is important, though, to develop an IEP or a 504 accommodation plan. And this would really depend on how much school refusal or other psychiatric kind of underlying conditions are getting in the way of the child participating in school and being able to make academic progress. Now, some examples of accommodations that might be included on a 504 plan or in an IEP might be just allowing kids to use certain relaxation strategies in the classroom, being allowed to take breaks from class if they're feeling overwhelmed, having a person to go to if the child's feeling upset, and having access to individual counseling on a weekly basis at school, or maybe even less often, just depending on a child's particular needs. So now let's turn to some tips for caregivers. It's really helpful to have regular morning and evening routines so a child knows exactly what to expect every morning and every evening. And it's really helpful when caregivers can reinforce child's positive behaviors. So lots of attention and praise for what kids are doing well, such as getting up in the morning to get ready for school or going to school. And it's great when caregivers can ignore mild misbehavior, such as whining or crying. Caregivers can also set up rewards for school attendance, which can be a great kind of motivation for kids to be going to school. And it's important that caregivers are listening carefully and just asking questions to get a better sense of how school is going. So these would just be open-ended questions during everyday conversations, such as, tell me about your teacher, how is homework going, tell me about your English class, who have you been spending time with at school, how are you getting along with students at school. And it's just important to be listening in a very non-judgmental way and gathering information, because we do want to make sure, like I said before, that the child's not refusing school due to bullying or some other legitimate cause. And as I mentioned, we want to get kids back to school as soon as possible, so we want to avoid not just having them be out of school longer, but when they are out of school, we don't want them having access to really enjoyable activities. No technology. We want to be approximating the school day as closely as possible. So whatever the child's doing when home from school is going to be mirroring what would happen at school. And it can be helpful for caregivers to set up informal meetings with people at school, teachers, school counselors, just to talk about any concerns that the child might have mentioned about school or about work, so that the caregivers, the children, the teachers, and other school professionals can be working collaboratively to address any of those issues. And I want to point out that if there are any kind of somatic symptoms, then it's really important to have a comprehensive medical evaluation. And because we want to be able to rule out any potential organic causes or biological kind of reasons or conditions that could be interfering with going to school. Now, anxiety can certainly present itself in physical ways, but there also could be other physical issues going on. So if a child's complaining of somatic symptoms, there might be a physical ailment, there might be these low-intensity physical symptoms that are being amplified, or there could be physical problems that don't have an organic basis. Nonetheless, it's really helpful to know this. So I recommend going to a pediatrician and having this evaluation, and then if other concerns are noticed or there's a need for further evaluation, the pediatrician can refer to a specialist. Now, what do we do, though, about more serious cases of school refusal? because sometimes school refusal is not going away on its own, or maybe you're trying some of these other strategies and they don't seem to be having the impact you're looking for. So I want to mention that it's really important to reach out and ask for help to prevent any further exacerbation of this problem. So it's good to seek help from a mental health professional who has expertise in treating school refusal. You can ask a child's pediatrician for a referral for this kind of mental health professional, or ask someone at the child's school for a referral. But I do want to say that it's very important to be a good consumer of mental health services for school refusal, because what happens under the umbrella of therapy can vary dramatically. And so we just want to make sure that kids are getting connected to services that are going to be effective and reduce school refusal. So I want to spend time talking with you now about an evidence-based approach to assessment and treatment for school refusal. So first, starting with an assessment, ideally this assessment will be multi-method, meaning that there are different methods like clinical interviews, questionnaires, observation, and we also want this assessment to be multi-informant. So we want to have the child, the caregiver, teachers involved in providing information about what it is that's happening. So this comprehensive diagnostic assessment could be including observation, interviews with questions about any kind of life events, or about if there are caregiver-related issues or reasons a student might not be going to school. There also will be a thorough review of medical and school records. We want to have a good sense of attendance history. And questionnaires are often used. One that I find really helpful is the School Refusal Assessment Scale Revised. And in the case that there could be cognitive or academic challenges that are contributing to school refusal, there could also be some cognitive and academic testing. An important goal for this assessment is to better understand the reason why a child is refusing to go to school. And from this assessment, we'll be able to come up with an individually tailored treatment plan. So I've found it's really helpful to think about 4 potential functions of school refusal behavior. This seems to be a good summary that really captures the different reasons kids might not be going to school. The first is to avoid school-related stuff that provokes anxiety, like particular teachers, difficult subjects, busy hallways, or even riding on the bus. The second potential function is to escape aversive social situations or evaluative situations. Now, these could be situations with bullies, with even just working with peers in a group, having to stand up and read in front of a class, and walking past older students in the hallway. The third potential function is to pursue or receive attention from significant others outside of school. Now, this could be parents, it could also be pets, anyone that the caregiver really cares about, that they could be getting that one-on-one attention from. And the fourth potential function is to pursue tangible rewards outside of school. So this could be watching TV, or playing video games, or reading favorite books, playing on phones, shopping with parents, sleeping in. And I want to mention that the first 2 functions are types of negative reinforcement. So in other words, they're getting away from something unpleasant at school, whereas the second 2 functions I've mentioned here are for positive reinforcement. So to pursue something or someone who might be attractive or enticing to them outside of school. Now, before we talk more about treatment, I will say some kids are refusing to go to school for more than just one of these reasons, in which case the treatment that will be developed is going to be more complex and might have an extended time frame. And before getting into treatment, it's also important to think about, are there other factors to consider? Because if so, these will need to be addressed before moving on to treatment. So these other factors are things I've mentioned, like school victimization or bullying, in which case there'll need to be some kind of school-wide or classroom intervention targeting bullying. Maybe a caregiver is deliberately keeping a child home from school, which we call school withdrawal. And there are common reasons for school withdrawal, such as parental anxiety, using the child as a supplemental economic source, so maybe the child's providing work or is providing childcare. This could also be an attempt to disguise child maltreatment, and there could be parental fears of the child being kidnapped by an estranged family member or person outside of the family. There could be peer-related safety issues and even complaints about the quality and appropriateness of teachers or the school in general. And so, once the assessment has been conducted, you'll have that information as well, and you can address those issues before kind of moving forward with this treatment that will be targeting those 4 functions of school refusal behavior. So after this assessment, then you'll be able to develop this treatment plan that will be individually tailored. And for some of the most kind of common types of treatments, you'll hear they fall under the umbrella of cognitive behavioral therapy and behavioral parent training. And the goal for both of these is to increase regular school attendance. So for cognitive behavioral therapy, an important component will be exposure therapy, which is going to involve gradual school reentry, which of course necessitates this close collaboration between caregivers, school personnel, and the therapist. Now, in addition to this more psychosocial kind of intervention involving cognitive behavioral therapy and behavioral parent training, pharmacological treatment may be beneficial as well and can be used in conjunction with these other approaches. It's not meant to be the sole intervention though, and that's because it's really important that kids develop skills to master their difficulties so that if medication is discontinued, there will not be a relapse in school refusal behavior. Nonetheless, for kids who do have these more severe underlying psychiatric conditions involving anxiety or depression, for example, medication has been really helpful and can be really helpful. And also, as part of treatment, school consultation will be important. So the therapist really pairing and teaming with people within the school setting so they can be working together to develop this kind of collaborative plan for how to help the child with school reentry. I'm going to tell you a little bit more now about cognitive behavioral therapy and behavioral parent training. So first, starting with more of the child-based techniques. There's been strong support from randomized controlled trials that are very specific to school refusal, and so this is our gold standard of types of research. And what's been shown to be helpful in terms of these child-based techniques would be psychoeducation, which is teaching kids, caregivers about school refusal and any other comorbid psychiatric diagnoses. As part of psychoeducation, it's also helpful to teach some kind of method for gauging one's mood or level of anxiety. So I use something called a feelings thermometer, or maybe it's a fear thermometer. And so then that'll be used later on in treatment to make sure the child's able to let you know how things are going with the school reentry. Another helpful approach as part of these child-based techniques are anxiety and stress management techniques. So this would be progressive muscle relaxation, where kids learn to systematically tense and release the different muscle groups throughout their body. Diaphragmatic breathing is another very helpful technique, and that is this deep breathing, and good for being used in any situation because no one even has to know kids are doing it. So it's a good way to calm down quickly. Also, imagining a relaxing place, thinking about all the different senses can be really helpful for kids as a stress management or anxiety management technique. And then the real core to this kind of intervention is the exposure therapy component. And for that, there'll be the development of an avoidance or an anxiety hierarchy where you'll be able to kind of break down what these gradual steps will look like, eventually leading to full-time school attendance. Cognitive restructuring can also be a helpful technique to use with kids. And what I mean by this is being able to help kids identify negative thoughts that are either untrue or that are just unhelpful and change those thoughts to more positive, realistic thoughts. Now, this technique I really just use for kids typically who are 9 years of age and older because it requires this ability to think about your thinking. And then for caregiver-based techniques, what is helpful to think about is that in general, behavioral parent training has been shown to have strong empirical support, It's been applied less frequently than child-based techniques for youth with school refusal. Nonetheless, it can be an important and helpful addition to the work that you're doing directly with kids. So some of the things you might work on are differential attention. And so for that, we're helping caregivers to give attention to positive behaviors and withdraw attention from mild misbehavior. And also help caregivers to be able to deliver instructions in the most effective way that will make it more likely that kids will comply with requests. And caregivers can set up rewards for school attendance and consequences for non-attendance. And sometimes it can be beneficial to include all of that information, so both those rewards and those consequences, into a written contract that the caregiver can sign, the child can sign, so everyone's on the same page. And for some kids, particularly younger kids, it can be helpful to escort a child to school and make sure that there's that safe person who's been identified at school to help with that transition to being at school. So, what I want to mention kind of as the big picture that kids are not always very happy to hear from me is the best way to overcome school refusal, particularly school refusal that's anxiety-based, is just to get more comfortable feeling anxious and realizing that they can feel that way and they can stay in the situation, nothing bad will happen to them. So it's great when kids are able to go to school because then they learn that whatever their biggest fears were about going to school don't actually come true. And so I'm going to talk now more about a specific boy that I worked with just to kind of bring to light what these different techniques might actually look like. So I'm going to tell you about Jordan, and I've changed his name, but he was a 15-year-old Caucasian male who was referred to me for school refusal. His family had moved from Connecticut to the Boston area, and with the start of the academic school year, so right before classes started in early September, he went to one day of school in one of the local public high schools, and then he had not gone back to school since. And so I saw him about a month later in October, and the caregiver, the mom was really concerned that he wasn't going to school. So I did an assessment, and from my assessment, I was able to identify both the challenges that Jordan was facing as well as his strengths. And so in terms of challenges, he had pretty significant depression and also anxiety that I could tell were really interfering with him being able to go to school. He also had a variety of somatic symptoms. So he tended to really feel his anxiety in these very physical ways. He had nausea, vomiting, stomach aches, diarrhea, and I wasn't sure at that point whether these also had some kind of more organic basis. He had some academic and cognitive difficulties, which I had known about because he had had previous evaluations done that had identified that he had a learning disorder in reading, and also that he had slower processing speed. So when he heard information, it took him more time to really be able to understand it and then do something with that information. He also had a variety of family stressors. So earlier that year, back in March, a few months before, his parents had gotten divorced, and also his father had a long history of alcoholism, and he also had depression, and so the father was in and out of his life, and I knew that that was also really hard on Jordan, who cared so much about his father. Now, in terms of strengths, Jordan had really great social skills. He was a pleasure to spend time with. He always had, interesting things to talk about, and I could tell from what his mom had told me that he had been good with his peers also, had lots of close relationships over the years. He was also very motivated to attend school, which is not always the case with school refusal, but he actually wanted to be in school. He loved learning, and he just didn't know how to get himself to go back. He also had parents who cared deeply about him. His mother, who took care of him on a day-to-day basis, but even his father, who had his own significant substance abuse and mental health concerns, really just wanted the best for Jordan. And when I was trying to understand which of those 4 functions of school refusal were in play, I realized it was all 4 of them. So I knew that we had our work cut out for us. So he was avoiding school-based stimuli. It was uncomfortable for him to be in his classrooms, especially in his English class where he had difficulties with reading. He also was trying to get out of any kind of aversive social situation, so he didn't want to be judged for not being in school, and he was really concerned about any kind of class presentations or times where he could be negatively evaluated. He was enjoying the extra attention from his mom whenever he got to stay home with her, because they did have a really strong relationship. And he was enjoying all kinds of rewards outside of school, like watching TV whenever he wanted, just staying in his comfy clothes throughout the school day. So I could tell that this was going to need to be, a more complicated intervention, and that it might take some time to address all these different functions of his school refusal. So now I'll talk to you more about, having done that assessment, what treatment looked like. So the first thing I did was I had him get medical evaluations, first by his pediatrician, who also wanted him to see a gastroenterologist because was concerned about these gastrointestinal symptoms. And then I worked closely with the school because we knew that we needed to make sure he was still learning and that home could look like school while he wasn't there. So we were able to set up tutoring where someone came to his house on a daily basis while we were working on his school refusal. And then I focused on providing education about school refusal using a cognitive behavioral therapy model, and I provided psychoeducation about anxiety. So let me tell you what that looks like. So first, for the psychoeducation about school refusal using the CBT model, so I emphasized that cognitions or thoughts, behaviors, and emotions or feelings are all connected. And so in order for him to really understand what I meant by this, we use particular examples from his life related to school refusal. So in terms of thoughts he was having, he was thinking, I won't be able to make friends if I go to school. People are going to make fun of me because I've already been out of school for a whole month. And that was impacting his behavior, because then he was refusing to get ready for school in the morning. He was refusing to leave the house in the morning. He was arguing with his mom, so it was causing more conflict between them, even though they had such a strong relationship. And in terms of emotions, these thoughts, these behaviors were certainly resulting in anxiety, embarrassment, sadness, and frustration. So I helped him see that, we have all kinds of different emotions or feelings in our body, and while we can't immediately change those, we actually can change our thoughts or our cognitions and our behaviors in order to feel better, and as a result change our emotions. So I said, what if instead of these thoughts you're having, you thought, well, I've been really good at making friends in the past, so maybe it's worthwhile to give these new students at school a chance. And maybe people won't even notice that I haven't been in school because, all these people are freshmen and they might think I just, changed into these certain classes that they're in. And what about if he changes behavior? So what if instead of getting ready to go to school in the morning, he actually went to school? Could that by itself even start changing some of these thoughts where he's then thinking, oh, school isn't quite as bad as I was expecting? And all of these changes in his thoughts, his behaviors can really impact the way he's feeling so that he can increasingly become more comfortable going to school. I also helped him understand anxiety, because whenever he walked into school, he felt just this overwhelming sense of anxiety. So the way I explained this to him was that anxiety is like our body's alarm. And thank goodness we have it, because it keeps us safe that we have anxiety and we have this alarm in our body. And as I'm about to go across the street, I feel this surge of anxiety, and it makes me look both ways. So then I won't get hurt when I'm crossing the street. But I said that some people have really sensitive alarms in their body. And so their alarms end up going off during times that aren't actually dangerous, where nothing bad would truly happen. And I call these false alarms. And they're scary because they feel just the same as these true alarms. They sound just the same as the true alarms. And they can make us act in ways that are not actually keeping us safe, and maybe they're just getting in the way of our life. So I said the best way that we can reset your body's alarm and make it so that you're having your anxiety still working, you're still having your alarm, but less of these false alarms, is to actually go into these situations that are safe, being at school, letting your false alarm go off, and then showing yourself that nothing bad actually happens. So from there, before we got into more of this the content of treatment, I realized that his depression was really getting in the way of him being able to go to school. So I used some of the most effective strategies from cognitive behavioral therapy to address his depression. One is behavioral activation. So this is being able to reintroduce him to reliably mood-enhancing activities so that on a regular basis he is doing fun activities that he enjoys to increase his mood, make his mood feel better. And also I taught him that if he's feeling down, he can use these different fun activities as ways to feel better in the moment. I also taught him a systematic problem-solving method because there are lots of situations that we face in which maybe we feel overwhelmed or feel like it's going to be hard to move on and feel really upset. And I said a lot of these situations you actually can change if you view them as problems to be solved. So I wanted him to have a way to solve these problems. So we worked on that, and then I taught him some relaxation strategies. So I know I mentioned before progressive muscle relaxation, deep breathing, and then I worked with his mom, who had the best possible intentions, and she just didn't want him, though, to feel distressed, and she felt bad about the divorce that had happened and the impact that it had on him. So I wanted to help her to really understand how to continue to have this strong relationship with their son and to be able to use differential attention, to be giving him more attention for going to school and any attempts to go to school and his other good behavior, and to really be ignoring this mild misbehavior when he starts crying or whining or fighting with her about going to school, and taught her about giving effective instructions related to getting him ready in the morning or even getting him to do his tutoring before he was actually ready to go back to school. And so I was working closely with her because, parents could have so many different responses to school refusal, anywhere from being so frustrated with their kids that they're not going to school, screaming at them, telling them just to get over it, all the way to parents who are overly coddling their kids because they don't want them to feel any kind of distress about going to school, or anywhere in between. So we really want to help parents to be loving and firm in general, and certainly also in the case of school refusal. Then it was time for us to work more on this gradual school reentry. So what we did was we came up with a game plan for how we were going to do these exposures. So for some kids, I'll talk about creating a bravery ladder. For someone older, I'll talk about a hierarchy. But basically what we're going to do is we're going to break down into small steps, getting all the way back to eventually going to school for the full day. So the bottom of this bravery ladder, this hierarchy, would include maybe just walking around outside of school after hours, which was the first step that we took with him. Then we walked around inside of school after hours, so no one else was there, just me and him. Then got him to meet with the school counselor and school psychologist while the other students were in class. So he just got to be in the school while other students were there, but didn't have to interact with any students. We continued to make our way up this ladder, or this roadmap we had created together, by then having him sit in the counselor's office for 30 minutes. Next, we had him just meet his teacher for his favorite subject. And then eventually we had him attend just his favorite class, and then had him attend his favorite class and lunch, and then his favorite class, lunch, and his second favorite class, slowly working our way up to him being able to go to a full day of school. And now I also taught him cognitive restructuring, which some thought repair just happens as part of this exposure, because you are having kids face their fears. So what can be helpful is saying, what are you afraid is going to happen before they go? And, for instance, Jordan went in, met with his school counselor for 30 minutes. And then after I said, okay, did what you were afraid of actually happen? And you say no. And so that's a way also to change these negative thoughts and beliefs that can really underlie school refusal behavior. But I also taught Jordan just to be able to identify his negative thoughts that were making him feel upset and that were distorted, and then change them to more positive, realistic thoughts. because of his level of depression and anxiety, I realized it was really important to also have him get an evaluation by a psychopharmacologist, so a psychiatrist specializing in treating depression and anxiety in teenagers. And she did prescribe a medication. She gave a selective serotonin reuptake inhibitor, so one of the most common medications that might be prescribed for depression and anxiety in teenagers. And this was really helpful because it was challenging for us to be making our way up this bravery ladder, up this hierarchy because of this interfering depression and anxiety. And once I was able to get Jordan in the school, even just for some time during the day, then it was possible for him to undergo a school evaluation, which was really important so that the school could determine his academic and emotional and behavioral needs and develop appropriate supports. And so we were able to do that, and he was given an IEP. And then we continued on with our exposure therapy and our gradual school reentry. And this was not easy, so we started in September of an academic year, and by the end of the school year, he had been going to a full day of school, but he was still shy of 2 course credits to graduate from 9th grade or finish 9th grade. So over the summer, he was taking 1 class in person and 1 class online, and he actually just finished those 2 classes last week, and so he will be going on to 10th grade, which is really exciting. But I'm thankful that the school has been so helpful and has worked closely with me, because we know that we still need to be implementing his IEP and working closely together in hopes that this next year will be a much better year for him. And in the meantime, I'm continuing to do family therapy sessions because the father is really wanting to be more a part of Jordan's life. And with his substance abuse and his mental health concerns, we're just trying to figure out the best way to do that so that Jordan's emotional, mental, well-being is really being protected. So that's my example of Jordan. And next, I just want to summarize some of our key points. So just quickly, school refusal is a complex issue. It's multi-causal, so many potential causes. It's important to recognize school refusal early and intervene using a team-based approach. We want to make sure to keep in mind the importance of this close working relationship between those who are going to be supporting a student returning to school. So I can't emphasize enough how important it is to really enter any meetings that involve the child or the caregiver in the school and reminding everyone of this shared goal. We just want to help this child be able to learn well and be in this academic setting with all of you. And for any somatic symptoms, get a medical evaluation so that there's an accurate understanding of any kind of medical symptoms, and so we can ensure appropriate intervention. And also, be a good consumer of mental health services for school refusal. So now you have a sense of what a comprehensive assessment might look like and what evidence-based treatment would entail, as well as the importance of school consultation. So with that, I want to now turn to questions.
Thank you so much. That was amazing and so easy to follow. So CBT and the transdiagnostic approach is wonderful. So I do have one question. Please start sending your questions. You have to type them in for me so that I can pass them on to Lauren. One of our SESPs actually asked, how do you address the parents' behaviors through the school? And I know that is sometimes the most difficult piece. Mm-hmm. And it sounded to me when you were talking about the case study that you had a real hands-on approach to that. So in the situation where the caregiver might not be a parent, could be a grandparent, or it could be someone in the foster care system, or even a staff member in a residential facility. Whose responsibility is it really, Lauren? It's going to have to be the schools, I would think, because there might not be that caring parent or parent-like caregiver that can start the whole process going. So that kind of puts the onus of the intervention on probably the adjustment council, the school psychologist, or something like that.
Yes, so I definitely think that, people at the school, such as the adjustment counselor, school psychologist, will need to play a really important role. And I think it's also helpful to talk with someone outside of the school who's a mental health professional who can really be helping to also create this plan, so it doesn't all fall on one person, within the school to come up with this kind of plan.
The team approach.
Yeah, use a team approach.
Yes.
Yeah, use different people's expertise and bring those together to really support the child.
Yes, that's a great idea. Okay, so this is an interesting question. What are your thoughts on home tutoring reinforcing school avoidance?
Yeah, so that's a great question, right? So, ideally, we're getting kids back in the school rather than having to set up tutoring. And the case I described, this was more extreme, where it was so challenging to get him back to school, and we didn't want him to just be missing information he could be learning in school, which is why we had set up tutoring. So if tutoring is set up, the plan needs to be still, let's help this kid return to school as soon as possible. And so tutoring isn't always necessary. Maybe sometimes teachers can just send home homework that needs to get done or classwork that was assigned, and as long as there's someone that can make sure that the child is doing that at home, that certainly works. It's for more kind of severe cases where I think that sometimes tutoring is good just in the meantime until maybe medication takes effect or until the student can really start making progress with this gradual school reentry.
And I think that whole idea of yours, the psychoeducation, the older kids, of course, you do it differently, but to let the student know that that is a time-limited response, and you're only doing it because we want him not to fall, or them to fall behind.
Exactly.
Yeah, to be quite honest and out there with whatever the intervention is.
Definitely.
So some people are very interested in that cognitive restructuring, and I'm also very interested in that. So could you give a couple of more examples of that?
Sure. So this is one of the most challenging techniques, I think, to use as a therapist. So the idea is you want to be listening for children that are saying thoughts that we know, first of all, are not true or are not helpful. So an example of a thought that's not true is if I stand up in front of the class, I'm going to make so many mistakes and everyone in the class is going to laugh at me. So I would say that's very unlikely that that's going to be true. And so what you would do as a clinician is think about what's the thought that you want this child to get to. So maybe something like, if I stand up and read in front of the class, I might make a mistake, but probably no one will notice. And even if they do, they're not going to be thinking about it a few days from now, maybe even by the end of today. So knowing that, then you use that to guide your own line of questioning, your Socratic questioning that's trying to get them towards that point. So maybe saying, all right, well, do you think that all people make mistakes, when they do a presentation, at least at some point, and when, do you know anyone in your class who's made a mistake? Okay, when that happened, did everybody in the class laugh at that person? And then maybe the child can say, oh no, I don't know that anyone noticed, or maybe only a few people noticed. And then, how long, can you think of someone who made a mistake? How long were you thinking about that mistake after that? And you're kind of leading them down this line of questioning so that they can get to a point where they say, oh, okay, okay, maybe another thought I could have instead is more like what I had originally said. And so that can maybe help them feel a little better. But sometimes the thought is true, but it's just not helpful. So when I go back to my English class, people are going to be asking me where I've been for all these months or weeks or days. Well, so maybe that is what's going to happen. So then what you help the child do is change that thought to something that would be more helpful, like, yes, people might ask me where I've been, but, I can tell them whatever, excuse I want for where I have been. And then, so knowing that is going to kind of guide you through your line of questioning, that can be.
Okay, so we are running out of time, so I'm going to ask a question about insurance.
Okay, sure.
A lot of the kids that are SESPs and a lot of schools deal with are on Mass Health. Now, I know you're from the Cambridge Health Lines, which takes Mass Health, but do they typically, who will pay for that comprehensive assessment that you spoke about?
So the comprehensive assessment can occur, as kind of the first session, when going to meet with a psychologist or a social worker or another mental health professional. So this could just happen as part of an outpatient clinic or a community mental health agency or a hospital setting. And so that will be that first appointment, and usually at least part of that appointment is covered by insurance.
Yes. So it's essentially, it will be outpatient. It won't be something that the school will be able to do.
So yeah, usually it's outpatient. If you're thinking this is a more serious case of school refusal and you really want some extra support, the school could certainly start by trying to get a better understanding and work in tandem with a mental health professional on this.
All right. Okay, gotcha. All right. So I think we are out of time, and we did have a question about the school versus the parents and the different points of view, and I think you addressed that by saying it really needs to be a team effort. A collaborative effort, and having worked in the community myself on school refusal, that was the only way that we actually were successful, was to have the school, the parents, and the kids all working together. So we all have to overcome that them versus us type of approach.
Exactly, and realize that common goal, tying them together, of just wanting to educate this child and have the child back in school.
Exactly. All right, well, thank you so much.
Thank you.
And we will see you all next month. And goodbye.